Hello everyone. In this presentation, we are going to learn about CPT codes, their categories, and some common examples. First, what are CPT codes? CPT stands for Current Procedural Terminology. CPT codes are five-digit codes used to report medical procedures, services, and certain diagnostic services performed by healthcare providers. The CPT code set is maintained by the American Medical Association, or AMA. CPT codes are mainly used to communicate what medical service or procedure was performed. They are also important for medical billing, claims processing, documentation, and reimbursement. The CPT codebook is divided into three main code categories: Category 1, Category 2, and Category 3. Now let's understand the basic structure. Most Category 1 CPT codes contain 5 numeric digits. For example, 44950 is a CPT code for an appendectomy. Now let's move to the three CPT code categories. Category 1 codes. Let's start with Category 1 codes. Category 1 codes represent established medical procedures, services, and diagnostic services that are commonly performed. These are the most commonly used CPT codes in medical billing and coding. Here are three examples. First example is 44950. This code represents an appendectomy or surgical removal of the appendix. Second example is code 71045. This represents a chest X-ray single view, which is a common investigation procedure. Third is 85025. This code represents a complete blood count, or CBC, with automated differential WBC count, which is routine blood test. So remember, Category 1 means established and commonly performed medical services and procedures. Category 2, codes. Now let's discuss Category 2 codes. Category 2 codes are used mainly for performance measurement and quality tracking. They are generally optional and are not used to report the main procedure for reimbursement. They generally do not have payment assigned to them. Category 2 codes usually have 4 numbers followed by the letter F. Let's look at two examples. 2028F indicates that a foot examination was performed. Another example is 1036F, which indicates that the patient is a current tobacco non-user. So the easy way to remember Category 2 is Category 2 equals quality and performance measurement, and the code generally ends with the letter F. Category 3 codes. Finally, let's talk about Category 3 codes. Category 3 codes are temporary CPT codes used for new and emerging technologies, procedures, and services. They allow new technologies and services to be identified and tracked while they are developing. Category 3 codes usually contain 4 numbers followed by the letter T. For example, 0042T is code cerebral perfusion analysis. Another example is code 0071T is for endovascular repair procedure. So remember, Category 3 codes used for coding of emerging new technology and services, and Category 3 codes generally end with the letter T. Understanding these three categories is an important foundation for learning CPT coding and medical billing. For more knowledgeable videos about medical coding, like, share, and comment to our channel. Thank you for watching.